Wednesday night edition of Barkman Smith's Facebook videos. Tonight with me I have Miss Zuri and Mr. Levi here to help me out as we talk about heel pain in children. So as a parent, if you've ever seen your child limp, complain of heel pain, sometimes the kids walk on their toes to avoid the pain, that is something that can be quite concerning and something that typically you'll seek medical attention for if it doesn't go away, and you should. So here I get a lot of diagnoses of something called Sever's disease or calcaneal apophysitis. What's going on there, Levi's agreed to let me help show. So Levi, if you'll slide your feet around. What happens when that's the case is kids have a growth plate that kind of goes right in through here, roughly. And so you have your Achilles tendon that comes into the bone. And, sorry, ticklish?
No, it actually hurts.
Oh, it hurts? I'm sorry. So when that Achilles hits this bone right here, it pulls on that growth plate if his calves are too tight, his or her. And then at the same time, you have your plantar fascia right here that attaches to the other half. And so when your kids have tight calves after a growth spurt or anything like that, it pulls apart on that growth plate and it can inflame the entire area. And so a lot of times just rest from activity, some orthotics that the doctor can give you, and obviously physical therapy can help with that. Tonight my plan is just to show you a few different stretches that you can kind of try on your own to see if that kind of helps loosen up the calves a little bit. Zuri here has been willing to let me show you some stretches. Is that right? All right, so come over here. So the first stretch I usually show the kids, all right, you got to get your one foot like this. You can lean up against the table there. And you got to make sure, you got to make sure their feet are straight. Now you want to pretend like your foot is glued to the floor. There you go. Do you feel something right through here? I can't hear you. Oh, there, look, that foot right there. There you go. Is that better? All right. Do you feel that right here now? All right. So then that's part of the stretch, and you would hold it for a good 20 to 30 seconds. It's a long time, isn't it? Now you're going to bend the knee, and this is the next part of the stretch. And you see how the stretch moves down lower? And you would then hold that for 20 to 30 seconds. Not very fun, but not too bad, right? Your leg hurts? Well, then you're going too far. You don't want to make it hurt. Is that better? All right, now you can stand up. Another thing you can do with kids sometimes, since they're more flexible already, are you able to get down in like a catcher stance? Yeah, and you can even leave your feet flat like that. And sometimes you can sit like this for a minute. It's not very fun either, though, is it? Good, you can sit down lower if you want to. There you go. And that's a great stretch for kids, especially the littler ones. The older we get, the less likely we are to be able to do that, as this can be witnessed with me. So you can stand up now. Thank you, Zuri. You can have a seat again. And then another stretch that we'll commonly do in here is you go and lay down. Is you put a little pressure on their foot here, and that stretches out that half. And then what I end up doing is putting a little pressure on the bottom of the foot to stretch even more. And as you can see, Levi is quite tight.
Yes.
Is that stretching?
Yeah.
Is it too much?
More or less.
You can tell me less. And so it's always important not to overstretch. Is that better?
Yeah, it's fine.
And so that would be how we would stretch them in here. And a parent can do that gently provided that they're not putting too much stretch. And so those are some stretches you can do with your kiddo or have them do. Obviously, physical therapists are always willing to step in, and especially if you've seen a doctor, the doctor a lot of times will give you some orthotics and recommend physical therapy, and that's where we come in. We try to have fun with kids. We try to make sure it's a game of some sort. You can go and sit up if you want to.
Yeah.
And just kind of have fun while we can in here. So when it comes to heel pain in kids, I hope that little message helped. So upcoming in the first Wednesday in May, our next episode is going to be with Colin Terrell and getting to know your therapist.
Make sure to subscribe on YouTube and follow us on Facebook and like the video, please.
Thank you for joining us.
If you want to, drop your comments below if you have any questions about heel pain.
I should have let you do more talking.